As Medicare and Medicaid celebrate their 60th anniversary, you're facing potential changes that could significantly impact your healthcare coverage. These landmark programs, signed into law by President Lyndon B. Johnson on July 30, 1965, transformed healthcare for millions of seniors and low-income Americans. But today, proposed funding cuts and policy shifts threaten to reduce your access to doctors, hospitals, and long-term care. Before these programs existed, seniors faced grim healthcare options. Nearly one-third lived in poverty, and almost half had no health insurance. Many had to deplete their savings, rely on family, or simply go without treatment. Medicare and Medicaid changed that. Within a year, 19 million Americans enrolled, and for the first time, nearly all seniors had access to hospital care, skilled nursing, and home health services. These programs also advanced civil rights. Medicare funding helped dismantle segregation in hospitals, giving minority seniors fairer access to care. It was a pivotal moment in American healthcare, ensuring people received treatment regardless of race or income. Unfortunately, new legislative proposals threaten to reverse that progress. Changes to Medicaid reimbursement and federal budget rules could trigger automatic cuts to Medicare. Projections suggest potential reductions of approximately $533 billion over the next decade, which is roughly 4% annually. You'll likely notice these changes first in your local healthcare facilities. Hospitals and clinics already under financial strain may reduce services or staff. Rural areas are especially at risk, with fewer facilities and limited options. Lower Medicare reimbursements could also lead doctors to accept fewer Medicare patients, forcing you to wait longer or travel farther for care. Emergency departments, already stretched thin in many areas, could see increased patient volumes as other services become less available. The nursing home industry, which relies heavily on Medicaid funding, is especially vulnerable to these cuts. If you or your spouse needs long-term care, reduced funding could mean fewer facilities accepting Medicaid patients, longer waiting lists, or reduced quality of care. Healthcare providers will try to adapt by consolidating services, reducing hours, or cutting departments, but there's only so much they can do without sacrificing care. Some facilities may not survive at all, especially in smaller communities. As these pressures mount, the long-term stability of your healthcare access increasingly depends on the policies that shape Medicare and Medicaid's future. The choices made today will determine whether these programs can continue meeting the needs of millions of Americans in the decades ahead. In conclusion, the 60th anniversary of Medicare and Medicaid represents both a celebration of their success and a critical moment for their future. Americans have benefited from 6 decades of guaranteed healthcare coverage that previous generations couldn't imagine, but maintaining these benefits requires ongoing vigilance and advocacy. Whether you're currently enrolled in Original Medicare, considering Medicare Advantage plans, or exploring supplemental coverage, understanding how potential changes might affect your specific situation can help you make the best choices for your health and budget. For more information about Medicare, please call 866-633-4427 to speak with a Senior Healthcare Solutions Medicare expert. Thanks for watching. Like and subscribe for more videos.